surgery is essentially surgery for weight loss. And the goal of the surgery is not to make patients fit better into a bikini or make them look like a model. It's more to provide them a healthier life. And in terms of that, it means taking a patient who has diabetes and getting them off their diabetic medications, basically fixing their blood sugars, improving high blood pressure, relieving them of their back pain or their knee pain because of the extra weight. And that's how the bariatric surgery will help our patients. We do typically 3 procedures. One of them is the laparoscopic adjustable gastric band, which is a silicone band that is placed around the upper part of the stomach and tricks the stomach into thinking it's much smaller than it is. It does require quite a few adjustments, so it's pretty high maintenance. Another surgery that we do is the sleeve gastrectomy. That's probably our more popular surgery at this time right now. It's a simple procedure where we take the stomach and basically cut out about 80% of it and remove it so that the stomach holds less food. And that's how the surgery works. It also works by when we remove that part of the stomach, it also reduces the patient's hunger hormones. The third surgery that we do is a laparoscopic room-wide gastric bypass. And that procedure is where we take the stomach and cut a small pouch out of it, and then we rehook the small intestine up to that stomach pouch so that there's basically a restriction of by limiting how much food you can eat, as well as a slight malabsorption where you don't absorb as many of the calories. We've had a lot of success. We have a great program. Our dietitians, our nurse practitioner, all help our patients through their journey. For example, one of my patients, who was a younger patient of mine, he had obstructive sleep apnea, he had high cholesterol, he had the sleeve gastrectomy done. About a year and a half after his surgery, he had lost about 90 pounds, maintained that weight loss, ran a sprint triathlon, and about a year after his surgery, and then also just recently joined the police academy. So he's a patient of mine who's very proud of what he's done. So the process for undergoing bariatric surgery, it is a process. We don't just schedule the surgery next week. Usually we do offer seminars once a month that provide information about the different surgeries, and then usually at that point after that, patient is ready to make an appointment with one of the surgeons, myself or Dr. Ryan Tyner. We are both bariatric surgeons in our group. We do consultation. We discuss what are the best options for surgery with the patient, and then they go through a process where they meet with our dietitians for several months, as well as obtain a psychiatric evaluation to make sure that their mental health is stable. Once that's all done, we perform the surgery, and then the process is ongoing from there, where basically you are our patients for life. We meet with you for several months after the surgery, and then at least once a year forever to make sure that everything's still going well. So we do have a website, abqhpbariatrics.com. ABQ Bariatrics is all one word. And there you'll find all the contact information. There is a slideshow on there about the different surgeries, so if you have more information, that's where we'll also have information on the different surgeries. And then we also have an email address, bariatrics@abqhp.com, for any further questions as well.